Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In the last video, we talked all about anorexia nervosa, and today we're going to talk about bulimia nervosa. First, we're going to describe what the features of bulimia are. Then we're going to talk about the typical case of bulimia. And then we're going to compare similarities and differences between anorexia nervosa and bulimia nervosa. So if you like what you have to see, if you learn something new, hit the like button, subscribe, click the notifications tab. That will allow you to gain access to all of my videos and know when I release another one. So without further ado, here we go. So when we talk about the concept of bulimia nervosa, it is oftentimes referred to as a binge purge syndrome. Now, in all fairness, not every case of bulimia is it a purging subtype. There's also something called a non-purging subtype. But there are these characteristic binges, and a binge by definition is a bout of uncontrollable overeating in a short period of time. And objectively, most people would consider that excessive in that time period. So a numerical value that we put on the concept of binging is 1,500 calories. That's usually one of the standards. If you have one sitting and you've had 1,500 calories, that's considered excessive because it's roughly a whole day's worth of caloric intake. However, many people who have binges actually consume 3,000 or upward of 3,000 calories. So what's the typical case? The typical case is a slightly overweight female who's been on an intense diet, and ultimately they get some positive feedback. That's a similarity between bulimia nervosa and anorexia nervosa. We also see, like anorexia, it's about 90 to 95% of the cases of bulimia occur in females, and it has a slightly later age of onset of 15 to 21. And it is possible for this condition, a person has temporary relief, and then it might resurface again. So let's talk about the diagnosis, right? So according to the DSM-5, which is the manual we use for psychological assessment and diagnosis, in order to meet the criteria of bulimia nervosa, you need to have at least weekly symptoms for a minimum of 3 months, where an individual has some form of binge eating episodes, followed by some compensatory behavior. As I mentioned, it could be a purging subtype or a non-purging subtype. Purging is exactly what it sounds like. Things like forcing oneself to vomit or misusing laxatives or diuretics or enemas, things of that nature would be purging. Whereas a non-purging subtype is where a person might engage in excessive fasting or excessive burning of calories. So the purging subtype is more of secreting or excreting, probably is a better word, whatever you've ingested. Whereas non-purging is trying to burn the calories in one way or another. So one major difference between bulimia and anorexia is that when it comes to bulimia, generally speaking, the patients are normal weight, whereas anorexia, one of the hallmark features is the individual is significantly underweight, right? So people with bulimia, they have many times rapid fluctuations or weight fluctuations that they're not very happy about. It is possible for a person who has bulimia to also qualify for anorexia. So you might hear the colloquial phrase bulimorexia. That's a combination of the two or mixed features. And then we have another disorder, which we're going to talk about later in a separate video, called binge eating disorder. And that is a condition that was added to the DSM 5, where you have the binge eating pattern with no compensatory behavior. So there is more of an excessive calorie. So, what do these binges look like? We know that people have a wide range of binging, and it could be as little as one binge per week. It could be as many as 30 binge episodes a week. On average, we're typically looking at about 10 binges, and 10 binges is roughly 1.33 a day. Most of the time, these binges occur in secret, and they tend to be soft texture, high calorie foods, sweet foods, things like that. So I gave you what binge eating episode would be, but binges can be a wide range, 1,000 calories, 10,000 calories, major wide range that it could be. Typically, we're looking at 1,500 calories, and then on average, upward of 3,000 calories. So just to map out what anorexia nervosa, bulimia nervosa, and obesity, how they have, this is a Venn diagram. You could see that with anorexia, that's our bluish color. We have the restricting subtype, and then we could have binging purging subtype of anorexia, which we talked about. And you'll notice that the binge purge sequence is also linked to bulimia, right? So we have normal weight, bulimia nervosa, and then we can also have with, binge eating disorder, which is a separate condition. You're binging, but you're not purging. So you're not getting rid of the calories. That has some relationship to obesity. So you could see it's kind of on a spectrum. So restricting subtype, underweight, binging, purging subtype of anorexia, still, between underweight and normal weight, but the binge pattern and the purge pattern make it more consistent with bulimia. And then we have the last, right, binge eating disorder, and then obesity. So that's the connection, as I said. So usually we see binges start with a person feeling like a loss of control or powerlessness or tension. And as a function of this feeling of powerlessness or tension, a person might binge. Now, the binge itself oftentimes comes with some joy or pleasure or fun, but after the binge, there is oftentimes some guilt, shame, depression, self-criticism, fear of being discovered, and so forth. So the person binges, right? Now we have to undo the binge, and we undo the binge through compensatory behaviors. But here's the problem. Very rarely are you going to fully match what you ingested, because the lining of the stomach is going to absorb some calories regardless. So you're not going to get rid of everything that you binged. And that is another explanation why the common case of bulimia, the person is relatively normal weight, right? So you're trying to undo the caloric effects, but you can't fully do it. So the most common cases are vomiting. Vomiting has a long history as it relates to binging. If we go back to the Roman vomitoriums, they would have these large banquet feasts. People would eat excessive amounts of food. force themselves to vomit so that they could create more space for some more food, right? So there is this long history with vomiting. But as I said, vomiting fails to prevent about half the calories that you've eaten, you can't get rid of. So you're going to absorb some of these calories regardless. And similar to what we said about anorexia, forcing yourself to vomit affects your feelings of satiation, which if you don't feel full, you're going to be more likely to binge again. So it creates this vicious cycle. In terms of laxative and diuretics, that's more either defecation or urination as a way of trying to secrete whatever you ingested. So the compensatory behaviors provide some temporary relief to the feelings of guilt and shame, but it reinforces itself because, as I said, loss of control leads to a binge. Binge leads to a compensatory behavior. Compensatory behavior leads to temporary relief, but then there's more guilt again, and then loss of control, and then it goes around and round and round. So, what are some of the similarities between anorexia and bulimia? Well, we see that the typical cases in both of these, it starts after a period of dieting. So dieting is a common, initiation. We also see that there is a common fear of becoming obese. There's a drive to be thin. There's a preoccupation with food and one's appearance and weight. There are these mood-related similarities, heightened risk for suicide, substance abuse. There's a body distortion piece and distorted attitudes towards eating, like I don't want to give in to the urge to eat. But some of the differences are people with bulimia tend to have more of a social focus versus a control focus, right? So people with bulimia are more oftentimes concerned about pleasing other people, getting the approval of other people in terms of attractiveness, having intimate relationships. So as a function of this, we tend to see people with bulimia have oftentimes more sexual experience and activity. We also see higher rates of mood disorders and poorer coping mechanisms. So, and then in personality disorders, we see that roughly 1/3 of the people who are diagnosed with bulimia display characteristics of things like borderline personality disorder. That doesn't mean that they're going to meet the full criteria, but they're showing features like an unstable sense of self, difficulties in relationships, and so forth. Now, there are also different complications. We talked about anorexia and bulimia. In anorexia, we said it's fairly common for people who are so underweight to lose their period or menstrual cycle, but only about half of women who have bulimia lose their period. We also know that the damage is different depending on how the person compensates. So if it's a purging subtype, such as forcing oneself to vomit, you're going to have more issues with dental hygiene. You're going to have more issues with throat and esophagus issues. You're going to have more issues with stomach ulcers than anorexia. If you're doing laxatives, then you're going to have more issues with incontinence and things of that nature. So that is bulimia nervosa. I hope you understood the difference. Anorexia, you're oftentimes underweight. Bulimia, you're oftentimes normal weight. Same preoccupation with body image, but bulimia has hallmark features of binging and some compensatory behavior. In the next video, we're going to talk about binge eating disorder, which you have the binge cycle without purging, without the compensatory behavior. So once again, I hope you liked this video. I hope you found it useful. Again, help me bring this video to a larger audience. Click the like, subscribe, and the notifications tab. Until next time, people, take care.